Good morning, everyone. Today we'll discuss a little about superovulation. So, what is ovulation? Ovulation is wherein we have one mature egg develop from the ovary, and it's released into the fertilization tube. So that is our normal ovulation. What is superovulation? So wherein we have these in vitro fertility treatments where uh, if we have one uh, being released by our ovary uh, alternatively each month. That is, we have two ovaries, so one ovary releases an egg, the next month another ovary releases an egg. So it is like an alternative process. So when this is happening, it may not lead to successful fertilization uh, process uh, with relation to normal IVF. So then what happens, or then what is the solution to it is superovulation. So superovulation involves the use of fertility drugs to stimulate the ovaries to produce more number of mature eggs. So normal is one egg being nourished and uh, produced or released from the ovary each month. Instead, we can have 3 to 5 eggs being released. Now, how do we do that? So we have drugs which are, first one is human gonadotropins, that is FSH, that is follicle stimulating hormone, and luteinizing hormone. Both these hormones can be injected as such, and these are collected by postmenopausal women, the urine of postmenopausal women, as written over here. We can also have recombinant FSH and recombinant luteinizing hormone, which is uh, produced by recombinant techniques. Now, the next thing is how to go about this process of superovulation. So now, as we already saw, these two hormones that are there, they are going to stimulate the cells in the ovary to select some of the cells and then nourish them and turn them into a ovum. So it takes about 9 to 11 days for the gonadotropin to perform this function. Now, for that, what can be done? So, a small amount of this hormone is injected, and that depends from person to person of how much is the normal level in the blood that they have, and also how much are they responding to the external hormone that they've been injected with. Uh, Now, this work that FSH and LH are doing, they can also be done, or they can also be replaced with drugs such as Clomid and letrozole, which also will go in the body, and they are going to stimulate more amount of FSH and LH to be released from the body itself, rather than directly adding more amount of externally produced FSH via uh, recombinant technique or via collected FSH. Now, the benefit of this drug is that it is less expensive and can be taken orally, whereas the hormone that we are providing will be injected into the system. But the drawback is that these drugs, Clomid, are not as effective in releasing FSH uh, as much as we directly injecting the hormones. Now, superovulation starts on second or third day after our menstruation fully completes. This is when the body starts selecting follicles which will grow into the mature ovum. So instead of just selecting one cell, it is going to select 3 to 5 more. This is called follicular recruitment, wherein you recruit cells to be developed into the ovum. Then we come to the disadvantages of this is that most of the hormones or drugs being used, they do not have a stipulated amount of how much do we give, how much is safe to be given to a person, because a person responds differently to the hormone or to the drug being given. So the amount is variable. Also, a doctor cannot uh, directly uh, diagnose the patient with the right amount. So it has to be judged. So slowly the doses will be increased. So the starting dose is 225 IU per day. For older women, it can be increased, and when a person has PCOD, it will be reduced. The amount of hormone given is reduced. Now, the risk is that this method is known to increase the rate of multiple pregnancies. Uh, it does give good results, but the incidence of having twins is 20 times higher. The incidence of having triplets is 2 to 3 times higher. Uh, and more than that, like quadruplets is like 1% or more. We've seen nowadays we have more amount of triplets and quadruplets taking birth because there is more number of these superovulatory uh, fertilization taking place. So that is a potential risk, because then it is difficult for the gestating mother to withstand the growth rate of all the embryos. There is competition between the embryos to survive. So it is in all a complex situation. We also have premature deliveries because of this. So the uh, embryos or the fetuses then are grown in an ICU for a quite a big amount of time until they can be taken home. So these are the complications of having superovulation. Uh, and superovulation is only done after normal IVF conditions are tried, tested, and if it's still not working, then uh, superovulation is taken up. We can also store these extra eggs in uh, cryopreservation, so that every time we need not inject hormones into the patient, because that is also not good for the overall well-being of the patient, because it causes a lot of uh, hypersensitive reactions, irritations, uh, mood swings. Uh, it can also cause uh, imbalances in the menstrual cycle of the person. Therefore, once superovulation is done, the eggs can be saved and preserved using cryopreservation. Alternative to having superovulation is cryopreservation. Also, normal natural IVF cycle, wherein just one egg cell is produced and that is taken up for fertilization in a test tube. That uh, if that fails and we do not have any other uh, alternative or other solution, then we go for superovulation. Then we come to embryo culture. So how are these embryos cultured? We have an artificial culture medium uh, on which the embryo will be cultured. So before that, when the eggs are retrieved, they will be put in artificial culture medium. They will be then uh, treated with a conjugate of sperm cells, and fertilization will take place in the petri dish itself or the test tube itself. From there, they're going to be transferred into another artificial culture medium where they will be allowed to grow until they reach the blastocyst stage, in which they have to be then placed back into the uterus so that they get implanted, after which they won't get implanted. So before they reach that implantation stage, so it is very crucial that we place them back into the embryo, allow them to get implanted, and then continue with the entire gestation period of